Hello and welcome back to GP Video Podcast by Nadia. So, yesterday, if you guys remember, we started the topic of headache, its classifications, and then we were going to talk about migraine. So, we will continue with that today. So, as I said, that headaches are usually of two types, primary headache and secondary headaches. Primary headaches are again classified into three types. So, number one is migraines. Number two is tension type headaches, and number three is cluster headache. So these three are usually called or classified as primary headaches, while secondary headache, as the name indicates, is because of the secondary causes. So for example, because of any tumors or space occupying lesions in the brain, or because of any of the structures that cause referred headaches. So for example, anything arising from vision, deterioration of vision, coming from ears, coming from teeth, coming from any structure in the head and neck, like for example from the cervical spine, or from jaws, from teeth, from the maxillary sinuses, facial sinuses, ears, ear, nose and throat, anywhere coming from secondary structure to the head getting referred is known as secondary type headache. And also any kind of tumor or space occupying lesions in the brain can also cause secondary type of headaches. So these are the two types of headaches, primary headaches and secondary headaches. So when we talk about primary headaches, as I said, number one cause could be migraine. So migraine, basically, what is migraine? Because as I said yesterday, that usually when a patient comes to general practice and is the first time trying to get his or her headache evaluated, or to describe when he or she is trying to describe the headache, and if it's like really severe headache, they would name it as migraine. But migraine is not as simple as we think of it. Like migraine should have few characteristics or few features for us to be able to call it migraine or diagnose it as migraine. So if we talk about the prevalence in primary headache, as I said, that there are three kinds of primary headache. One is migraines, one is tension type headaches, and number three is cluster headache. So tension type headache is actually number one in prevalence. Like tension type headache is the most common type of primary headache, and number two is migraine. So migraine also has a few classifications, but we will not go into the depth of it today, but we'll start from explaining what are the characteristics or what are the stages of migraine. So a typical or classic migraine is usually composed of 4 stages, but not everybody who has a migraine has to go through all the 4 stages. It could be all 4 of them, it could be 3 of them, it could be 2 of them, or maybe just 1 of them. But usually a classic migraine does have 4 stages. So if I want to describe or put it in simple words, I would say that a migraine is a headache that can cause severe throbbing pain or pulsing sensation, usually on one side of the head. So unilaterality, or being on one side of the head or being unilateral, is actually one of the most important features of migraine. But having said that, it could be bilateral as well. It could involve both sides of the head, but usually it's unilateral, either right or left. Usually, let's say 80% maybe, it starts unilateral, can develop and go both sides, but usually it starts on one side of the head. So as I said, a migraine is a headache that can cause severe throbbing pain or a pulsing sensation, usually on one side of the head. It is often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. Migraine attacks can last for hours to days, and the pain can be so bad that it interferes with your daily activities. Now, this is a very, a very primitive or very primary definition of migraine. But now let's have a look at what are the 4 stages that I was talking about. So the 4 stages, the 4 classic stages of a classic migraine are prodrome, aura, headache, resolution, or postdrome. So again, prodrome, aura, headache itself, and then resolution. So what is prodrome. Prodrome, as the name indicates, prodrome means before the actual headache, what is happening. So 1 or 2 days before a migraine, you might notice subtle changes that warn you of an upcoming migraine, including constipation, mood changes from depression to euphoria, food cravings, neck stiffness, increased urination, fluid retention, frequent yawning. These are the symptoms that could happen in a prodrome. After prodrome comes aura. So for some people, an aura might occur before or during migraine itself. Auras are reversible symptoms of the nervous system. So, reversible symptoms of the nervous system. They are usually visual but can also include other disturbances. Each symptom usually begins gradually, builds up over several minutes, and can last up to 60 minutes. Examples of migraine auras include visual phenomena such as seeing various shapes, bright spots, or flashes of light. So, visual hallucinations basically. It could be reversible vision loss as well. Pins and needle sensation in one arm or leg, weakness or numbness in the face or on one side of the body, and difficulty speaking. So all of the nervous system symptoms which are reversible, especially visual, but they could also be like pins and needles, difficulty speaking, weakness or numbness. So this is called aura. So first a prodrome happens, then aura. So aura can be again either before migraine or during migraine or during the actual headache phase itself. So what happens in migraine or the headache phase, which is the actual phase itself? It's a pain that is usually pulsating and throbbing on one side of the head, sensitivity to light, sound, and sometimes smell and touch, and nausea and vomiting. Usually you would feel nauseous and feeling like you would vomit anytime, pain that is sometimes extreme in nature on one side of the head, pulsating and throbbing, and you are sensitive to light, sound, and sometimes smell and touch as well. How long can the migraine attack or the actual headache phase can last? It lasts from any time, anywhere between 4 hours to 72 hours. It can last up to that much if you don't medicate yourself or if you don't take the migraine specific medications, then it can actually last up to 72 hours as well. And what happens in the postdrome? After a migraine attack, you might feel drained, confused, and washed out for up to a day. Some people report feeling elated as well. Sudden head movement might bring on the pain again briefly. So these were the 4 stages of a classic migraine, but as I said, not everybody has to go through these stages. If not 4, then 3, 2, or maybe just 1, the headache part itself. But we will talk more about it in a more complex manner in my next video podcast. See you then.